Welcome everyone with your program Peels of Yunnan, who invade the most successful story in person here in UAE. Today from Dubai City with Dr. Deepak Gandhi. Welcome, doctor.
Good morning.
We are so happy to meet you today.
Thank you so much.
Well, doctor, today we need to speak about you, about your experience here in UAE from the beginning. Also, we need to know more details about you to present you for everyone.
I started my career in India. I graduated from BJ Medical College, Ahmedabad. Then I did my pediatrics and in NHL Medical College again it was Ahmedabad. Then I practiced in India for almost 10 years and 7 years back I came here. So in India actually I started my career as a general pediatrician, but soon I realized that I would like to do the pediatric intensive care more. So I started training myself in the pediatric intensive care. It was neonatal intensive care and followed by pediatric intensive care both. So I was running my PICU and NICU, and the youngest baby which I saved in India was 600-gram baby. So at that time it was a kind of achievement for me in my city. I was so happy. So I stayed there, and later on I realized, okay, I have to expand myself more. I started learning more about other types of the patients, just like thalassemia patients, developmental delayed child, and then other patients who required much more care in routine, just like and other rheumatic disease patients. So slowly I learned about them. Then I realized, okay, this is such a vast field and you cannot learn everything. So by that time I was working very hard, almost 18 hours a day. And I was losing my health actually. So then I decided, why not to learn new things and move to another country and expand our knowledge and learn, okay, what is the best for you. By that time then I realized the best for me is respiratory care in the kids. I started respiratory care in the kids around 2012. At that time it was at the miniature level. When I moved here, I took few diplomas in pediatric asthma and allergy. Presently I am doing another diploma in pediatric asthma and allergy. It's from University of Colorado, and it's being conducted in India, Delhi. And so right now my main aim is to provide support to the kids who are suffering from the allergies in UAE, and its allergies in UAE are too common. Like if I compare it with India or any other western part, I am feeling it's much more alarming here. It's increasing at the very fast pace. So I feel supporting the kids in UAE, especially for the asthma and allergy, either it can be respiratory allergy, skin allergy, digestive tract allergies. So this is going to be my future in pediatrics. This is what I am going to do and give back to the society in this specialized field now.
Before Dubai, before coming to this country, sure that you have some person from your beginning in life, it was the more supportive for you. They help you. Who's this person?
Right from the beginning, it was my parents actually. So right from the beginning, we were one of the brightest students according to them. But yes, so when I came to 12th class, they wanted me to become a doctor. I wanted to go to army actually, but my father wanted me to be a doctor. So I decided, I started preparing for it, and luckily I was selected in the entrance exam. I chose it, and after that it was my teacher who helped me to become what I am today right now. And she was the head of the department in medical college in Ahmedabad, India. And after that it was my colleague who helped me a lot throughout my life. So he told me like when to start the private practice. So I asked him, okay, which way to go. I practiced in India for almost 10 years after that. Then after that I decided, like, okay, I'm doing so much work, I want to learn new things, I want to explore the world, I want to roam around also. I want to see what is the latest technology, and the nearest place which I decided was this Dubai. So it was very close by and very approachable, so that I decided not to go to USA or UK after that. So I approached here, I gave the exam, I came here, and after coming here, luckily the people all around here, they are very supportive. Even my patients, my management, they all supported one by one. At each step, luckily by the grace of God, I was helped. So here I am today with you.
Doctor, if I ask you about the challenge of life, it's very important to have this difficult time, this difficult situation. But from your side, what's your challenge on life from the beginning?
From the beginning, in India, getting admission to a medical college is a little tough as compared. Yeah, it's not easy. So in my time, it was, I think, 2 million and 2 million students, and we were having seats 1640 to be exact. So we were selected out of them, and again getting the admission in the PG, postgraduate specialization in pediatrics, that was again a little tough. We did it, but yes, it was, we enjoyed all that. After that, the biggest challenge was how to get incorporated in the life of the society, because like me, there are many doctors, but what we are giving extra to the society, unless until we have that, you don't feel we are fulfilled. So that was my biggest challenge, how to contribute to the society, give back to the society. That was the challenge. And I wanted to have life with my family also. So once I became a doctor in my city, I was working almost 18 hours a day. So that was the biggest challenge for me at that time, how to give time to my family. So then I decided, if I'm going to stay in this city, it is going to be more tough. My kids were not recognizing me when I used to come at home at 12 in the night. Then I decided, let's change the city. Let's modify some lifestyle, let's learn new things, let's forget some old habits. Then I moved here, and after coming here, the working pattern is way better than India, because you have to work for 8 hours a day only. And then after that, you are free to study, you are free to spend time with your family, you can explore around, you can go to the rest of the world as well. So you make a balance of everything here. So if you ask about the challenge, now the challenge is how to learn new things for me. This is the biggest challenge right now, and how to contribute to the society of UAE, because the parents here, they are working continuously. For minor things, they cannot come to hospital. So I feel we should educate them in their society, either via the media or going to them in their society. That's the biggest thing I think we can do it here, because everybody has the insurance, but everybody cannot reach the right hospital and the right doctor every time, because the insurance has a limitation here. So then I thought, okay, the challenge in this society is to reach the patient in an appropriate way.
For 7 years, you choose to be here in UAE,
Yes.
especially in Dubai. But why Dubai, not another place?
Okay, the biggest reason was it is close to India. So when I am planning to UK or USA, it is very far away. And second reason was it takes a little longer time to get settled down in UK, USA, because I have to study again. And for the UAE, it was just a single exam. We cleared the exam, and after that we were ready to just enter the profession. So that was one biggest reason. And if I have go back to India, it's just a 3 hours flight, so I can go to Delhi anytime. And another thing, the profession here, they follow all the international guidelines. So you get to know doctors from all around the world. So my colleagues, my seniors, my juniors, many of them are from Pakistan, USA, UK. So they all are trained in different parts of the world. So I'm getting exposure to all kind of experiences from all around the world. So which is good for me.
Exactly. So when you come for this country, what is your opinion about the medical system in UAE?
Medical system, they are trying to incorporate everything, especially they are trying to create insurance for everyone. That is the one good thing actually. But the only thing is that sometimes the parents who cannot get the insurance everywhere, they have the insurance which are on the low level, and they cannot get the medical facility. But even for that, government is trying to give them free services. That is one good part. Second, they are incorporating all the new technologies from all around the world. They are tech savvy. They do anything to save the patient. Once the patient reaches the medical center, they will do anything. So this is the best part of the UAE system. Right? They are learning new things, and they are trying to incorporate the views from the parents. Any parents who approaches DHA even with a single complaint, they take it so seriously. That means doctors have to be on the toes always. they have to be updated, they should be very proficient what they are doing with the patient. So if they make any slightest mistake, DHA comes to know about it. So that means we have to keep ourselves updated and to the latest knowledge. So that helps us to gain new knowledge also, and helps us to treat the patient in a better way also.
Doctor, the medical system in UAE, now we speak about something like Dubai, it will be like best destination of the medical tourism in the world.
Yes.
How do you think about this point?
Actually, UAE is in the middle of all the world basically. If you want to move from one's eastern part of the world to the western part, so Dubai is a center point. Because of that and the approachability and the system here, it helps everyone to cater that services. Because in India, if I compare with India, basically the medical tourism in India is much more booming here because that is much cheaper. But there are few things which are in favor of Dubai also, because they provide you the latest technology and the latest treatment, and the government is so supportive. They're trying to expand its all the new varieties of technologies, new varieties of the treatments, and they are helping the people for that. So that will help in future, so that everybody can come here, and they are pretty sure that the doctors from all around the world, which are the best in their field, they are helping you.
Yeah, exactly. Also using the technology in the all side of life, maybe also in the medical system. So how you use the technology in your specialty, doctor?
In my specialty, this is actually we can use the gadgets. So in my pediatrics, all the otoscopes, laryngoscopes, these are the basic things which we need. But when it comes to the complicated cases like the latest bronchoscopy, and if I have to take help from the ENT specialty, or I have to take help from my gastroenterologist department, so they have the latest technologies to help with that. And the new technology feature which are still not available within our hospital, but they are available in other areas, other hospitals, especially in Al Jalila. If I refer a patient there, they have all the super specialty doctors there, they are helping them, and they have all the latest equipments to diagnose a patient. If something is missed in our hospital and we know we don't have it, luckily we have it in UAE. So that is good enough for a patient.
If I ask you, doctor, after this experience in UAE, also before coming to this country, about the success, what means the success from your side?
Success means being happy. That's the truth. Getting money, I think any doctor in the world can get enough money to survive and still save a lot. But yes, unless until you are happy here and satisfied here, it doesn't mean anything else. So if you are earning enough, saving a bit, donating a bit, giving back to society from your profession, that is good enough. Like you are doing it now. If it is going to help the society in one way or other, you should be satisfied with you.
Doctor, today you are an example of many doctors here in UAE. They think that you have this position is not easy to take it in Dubai. So from your side, we need a motivation message for the new generation of doctors.
So for new generation, I would like to say, keep patience. If you have knowledge, you are patient, and you have perseverance, you continue in your field, keep learning, that is good enough. So success comes by itself. That's it. You should go for the excellence. If you learn the best and work for the best, things will come to you. Give back to society and everything comes back to you. So don't be in a hurry, because in the doctor's field, it takes some time to learn, to practice, and to relearn again, because it's ever changing field. So if you have learned something over 5 years, maybe after 10 years it may be totally changed. So keep patience, keep learning, nothing else is needed. That's it. I would like to say to all the doctors, just keep patience. That's it. Take care.
Doctor, you are today in UAE, in Dubai, especially the best place for success, the best opportunity in the world here in this place. So from your side, we need some words for UAE government, for UAE leaders, the person who help you here in this country.
First of all, I would like to say thanks to the UAE government, because when I came here for the first time, I was a little apprehensive, like who will be supporting me. But within few months, I realized, okay, it's like my second home. And with the latest changes in the regulations, they started providing golden visas and much more opportunities to stay here with much more comfort and with security. So this looks like I can stay here for forever. Even my kids, they would like to stay here for forever. You can go around the world, roam around and come back to home. So I would like to say thank you, continue the support, and more people would like to come here and stay here and keep helping the government to grow more, to make the UAE much more supportive country, much more happier country, and much more healthier country.
Thank you so much, Doctor. We are so happy to meet you today, like a great example of doctors here in UAE. Thank you so much.
Thank you so much. Most welcome.
Thank you so much, everyone. See you next week with Pearls of You Know program. Bye-bye.